Now it is the time to start the English session. 8 o'clock we'll start the English session. Those who are joined for the Hindi session, thank you so much, and we will have same meeting tomorrow also. Dhanyavad, sabko dhanyavad.
Thank you. Dhanyavad.
And now it is the time for our English session. Today is our 961 day of Zoom session, our uninterrupted Zoom session without any break. We are continuously conducting this Zoom session without any break. We are only 39 days to reach the 1,000 days. So I'm appreciating all of the participants for your appreciation, support, and participation. Thank you so much. And let's start our meeting with a silent prayer. Thank you, all the participants, and thank you, Dr. Gurukiron. We already joined on time. Today's our guest is Dr. Gurukiron. No need of introduction about Dr. Gurukiron because he has taken many classes for IFPH, and all of the participants know you very well. No need of introduction, but even some those who are joining for today's session newly, if someone doesn't know, I just say a few words about Dr. Gurukiron. He's graduated from Bangalore Medical College of Homeopathy. He's a pure classic homeopath in Chamarajanagar. Last time also I was asking about the name of the place. I was
yes, it is Chamarajanagar.
And 14 years of clinical experience, and he is an independent researcher. He has postgraduate fellowship in SCPH, the International Center for Homeopathy from UN, and he has presented papers on psoriasis, thyroid problem, PCOS, epilepsy, hypertension, respiratory disorder, alopecia, infertility, and he has presented paper in TD Chandan on skin diseases. And I'm welcoming you, Dr. Gurukiron, for presenting. Today, he is presenting some of his cases, and after that, we will have a questionnaire session. You can ask your questions that time. Welcome, Dr. Gurukiron, once again.
Thank you. Thank you very much for your warm welcome. Yes. Good morning and good evening to some of them. Yes. Today's session will be somewhat some different session when compared to other sessions of mine, because it's an Dr. Danesh sir has asked me to engage with some queries, question and answers, and I told him, yes sir, okay, fine. I'll present 2 or 3 cases today, which is having very good clinical presentation, so that then after that we can interact with each other. Any queries, any questions after that, I'll definitely take it out. This case is a special one because recently on the occasion of World Homeopathy Day, I have presented this case in Madurai, that is in Prarthana Homeopathic Hospital, Madurai. So it was actually it was a competition there, acute case presentation competition there. Over 30 cases, almost 30 cases were presented on that day. In that, I have presented this case. Unfortunately, on the decision of the jury, I have awarded best rubric selection for this case. So I would like to present this case in front of you people today. Yes. So the patient name is GH. Physician name is mine, what Dr. Gurukiron has treated this case. Age is 82 years, female. Date of case taking is 3rd of May 2022. Case proper. The clinical diagnosis of this case is herpes zoster, also called as shingles. Onset was sudden. Duration was 5 days. Progress is fast. So what was the case? It was a patient of age about 82 years presented with the skin lesions on the right side of the face since 5 days. The eruptions were vesicular in nature with scab formation. Also with irrelevant speech. What was that? The patient used to repeat the same bisyllabic word. Whatever you ask the patient used to repeat the same bisyllabic word recurrently. And patient was a known diabetic, hypertensive, and COPD case since many years. When these two chief complaints was treated for the further management, the patient was admitted to hospital. 2 days back, it was started in the home. After that, she was admitted to the hospital for the further management. After being treated for 5 days in the hospital, there were no signs of improvement. Then the patient's guardian called me for the case. This was the thing. This was the discharge summary there in the hospital. See, they have clearly written patient has been treated from 29th 4th to 3rd of May. That's all. After being giving this kind of treatment, there were no signs of improvement. This was the thing in the discharge summary in the hospital. History of irrelevant speech. This was the thing. The patient had herpes zoster, trigeminalia right side. Also hypokalemia, hyponatremia, diabetes mellitus, uncontrolled. The qualified symptoms, the face eruptions. Reason for selecting this is because of it's a chief complaint or the particular complaint. And also I have said there is an irrelevant speech in the case, that is talks repetition of the same words. This is peculiar and uncommon symptom. And physical generals, patient is thirsty. So these are the qualified symptoms what I have considered for the case to evaluate. So after that, in the repertory, I have entered this case through an peculiar uncommon symptom, because this makes the very important point. Whenever you get an peculiar uncommon symptom in a case, it should become the entry point to the case. So I have entered a case through this symptom, that is mind talks repetition of same words, and face eruptions, herpes, then the physical general thirst. Okay, can you see the repertory chart? The close coming remedies apart from laxatives is Tuja, Natrium, Rustrox, and Sepia. So I have to rule out other drug, that is Tuja, and other three. By seeing the repertory chart, we can easily say that the totality which covers the remedy, which covers the totality of symptoms is the two remedies. One is laxasis and the another one is Tuja. And the Natrium, Rustrox, Sepia does not cover the totality. The close coming drugs, as I said, Tuja, Sepia, Natrium, and Rustrox. The prescription is, as we see in the repertory chart, that is laxasis. Laxasis mutus 200. A single dose. To consider, the acute totality covers the laxasis, and the progress of the disease is fast. So in this, the fast acting remedy is required for the case. The miasmatic background is sorosyphilitic. The herpes zoster belongs to sorosyphilitic background. Then the syphilitic mind, talking out of control, that is irrelevant speech. Syphilitic remedy has to be considered. So on basis of all these considerations, laxasis was considered. And Tuja was ruled out because it's a slow acting drug when compared to laxasis, because the progress of the disease is faster. So we have to consider a fast acting remedy than the slow acting remedy. The rule out drugs, especially Tuja, which is highly psychotic. As I said, we require a syphilitic drug because it has to cover syphilitic symptoms and also sorosyphilitic symptoms. And Tuja is slow in action when compared to laxasis. Sepia, Natrium, Rustrox does not cover the mind. As we see in the repertory chart, it doesn't cover the mind, that is talks repetition of the same word. So these are the points to rule out the drugs. And the potency selection, which is a major part, which is also very important part, that is 200C to start with, because the mind has involved and the syphilitic state. For any syphilitic case, 200 potency will be the apt potency to start with. And the mind has involved. I can go to a higher potency before that, because it has got the syphilitic state. So I started to choose the 200 potency, so that whenever we can need it, we can repeat the dose. Whenever we go to higher potency at the start time, we have to wait and watch. When we select a medium potency like this 200 potency, we can repeat the dose whenever it is needed. So remember repetition, lactis is 200, one dose for 3 days. Since it was an acute case, the progress of the disease is faster, so the repetition has been made. During the time of treatment, all the allopathic medications for the chief complaints were stopped. What they have presented for herpes zoster and the irrelevant speech. Then the follow-up analysis. 4th of May 22, the talking of the same words was arrested after giving the lachesis. 3rd, I took the case. 4th morning, talking of same words was arrested. No set of new symptoms, no aggravation of the symptoms, and interpretation and action is satisfactory result. And the 5th of May, the next day, skin lesions started to reduce. Only transient itching and burning was present. No set of new symptoms. Physical generals got better. Then it started to follow the Herring's law. All the acute cases has to follow Herring's law. And the 6th of May, skin lesions further has reduced. Transient itching and burning. No set of new symptoms. Physical generals still more got better. And it is also following the Herring's law. The 7th of May, skin lesions drastically reduced. Only occasionally itching, no transient burning also. On the 7th of May, no set of new symptoms. Patient is improving. The result is very good. So this is the follow-up analysis of the case. See, this is the photograph of before treatment. When they called me, see the vesicular formation which has formed into scab formation in the right side of the face. Just after 1 week of homeopathic treatment, after prescribing lachesis. See the improvement. See this video. Please observe carefully. This was taken before treatment. After 4 to 5 days of admission in the hospital, this was the situation.
Can you show the previous picture once again?
Yeah. This one?
Previous one, first one. Okay.
Okay. Please observe carefully this video. Can you able to hear the voice of the patient?
No, no voice.
No voice?
No.
Only she is talking the bisyllabic word.
Okay.
Puja, 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 puja. Whatever you ask the patient, this was a situation since 5 days. You want me to play another time?
It's okay, doctor. The picture was clear.
Okay.
Can't hear the sound. It's okay. You have mentioned, right? No problem.
You can observe the lip movement also.
Yeah.
Okay. After lachesis, this was a video after discharge in the home. Just after 1 day, the patient stopped the bisyllabic word, repetition of the same word. The next day, after prescription of lachesis. She is speaking normally.
Okay.
This is the potential and the magic of similimum. If we prescribe right medicine at right time with apt potency. So this was his report on 3rd of May. Before prescription of lachesis, the sodium is 134, which is low. Potassium is 4.4, and the chloride is 97, which is also low. After treating for 4 days in the hospital, this was the condition. Just after lachesis, see, sodium became normal on the 4th of May. It's 136, chloride is 100. So, learning from this case. Peculiar, uncommon, characteristic symptom as an entry point to the case. As in the aphorism 153, 154. And also mathematic concepts of Dr. Vijay Karsar help me in considering a remedy. Herring slush should follow after every acute prescription. Okay, that was first case. Now let's move on to the second case, which is also a very interesting case. What does this picture signifies? Anybody? What is your observation on this picture? Can anybody say this? We can have an interaction session. It would be very good, I think. Anything, whatever you observe, it tell me. What is there in the picture?
Urinary bladder distension. Some comments are coming in the chat box. Urinary bladder distension.
Okay.
I think residual wiring.
See, the observation is all the kidney, ureter, bladder is there. See the urine output there. Split.
Oh, okay.
Okay. This is the case. A male is about 66 years, was presented with the symptom of double stream urine since 1 month. Burning sensation in the urethra while passing the urine since 1 month. The patient has taken treatment for burning urine without any improvement. The main symptom, the chief complaint, what he had come for me is double stream of urine is still there, still present. There was no change in the double stream urine. So if we get a case in the clinic, so how can we approach a case and what can we think on this? What may be the causes? If a patient presents with, sir, I am passing urine which is having double stream, split urine. So what are the causes for this? We have to think that. What may be the reason behind it? When the patient says, I am passing split urine. The causes are adhesion due to thickening in the urethral region. The patient may pass split urine, or due to urethral stricture. Due to the stricture, it may be having two regions where the urine passes, so the output of urine will be split. Meatal stenosis, if there is anything like that, the urine will be in double stream. Also the phimosis, as we all know, this infection. For this phimosis, the surgeon advises for an circumcision. Phimosis, in one of the phimosis also, the patient may have double stream of urine. And the prostate enlargement. In this case, the prostate enlargement, because the age is 66 years. The male age is 66 years, so it may be one of the underlying cause, prostate enlargement. And the last one is the urethral polyps. Maybe in the urethra, he may having polyps, so that for that reason, the urine is having double stream. So how can we consider this case? What will be the approach? Yes, directly I move on to the repertory. There is a symptom in the repertory. Streams, the urine forms two streams as if in the urethra. So the single remedy rubric, that is prunus spinosa. So blindfoldedly I have prescribed this remedy, which is prunus spinosa. 200, 2 doses. And also have advised the patient for an ultrasonogram of abdomen and pelvis. After this prescription, the patient came to me saying, sir, after first visit, the patient is 25% better. After repetition of the same remedy, the patient is completely better now. So the patient didn't go for a scan. Patient said, sir, I'm completely okay now after prescription of prunus spinosa. This is the importance of entry point to a case. And this is the last case, just an observation. This is in my clinic. Please observe this lady, what she does in the clinic. This is my clinic chamber. Patient sits in front of me. See the lady. Can I observe the lady, what she is doing? On the basis of this, we have to prescribe. Snapshot prescription. Did you observe how she interacted with me? Now you can see it's closer now.
Please. You have many comments in the chat box. Are you
Yes.
restless, hiding face,
Smiling with shyness,
camera shy,
bashful, camera shy, timidity.
audio?
Again, these are all psoric and psychotic symptoms. There is one syphilitic symptom. There is one syphilitic symptom in the case. Did you observe that? What is that? If you see that that will become the entry point to the case. What was the characteristic in the case while she is talking? What was the characteristic in the face? Lot more closer. I have given a hint now. What was the characteristic in the face of the patient? Normally, if the patient speaks in front of a doctor, what does they do? What is this patient is doing? Did you observe? Can I give some more hint? When for the first time I saw this patient, some remedy flashed in my mind after seeing this case. Shall I give the hint, or can anybody tell me in the chat box?
Better to say yourself.
It's okay, try. It's an interaction session, no problem. It will be nice interacting with you people. I have to play the video again. Okay. Not hiding her mouth. No. See, observe this. I'm playing the video again. Yes, somebody has replied, Kiran, her eyes. You can observe the eyes of the patient now. Observe the eyes of the patient. What is that symptom called as? Eyes. Observe the eyes. What is the symptom called as? If you observe the eyes, how can we search a rubric in the repertory based on this? Can anybody tell me? Okay, now tell me, what is the gestures, making, eyes, gazed, avoiding, manipulative? Good, good. Very coming up, very good rubrics. Dark circles, avoid eye contact, mischievous look, manipulative. Okay. Right. See, eyes, lids drooping off. Did you observe that? Whenever she talks, the eyes, lids drooping. After getting some history, the patient mind is very much indifferent. And also I would like to stress, have you seen the video of cuttlefish? Cuttlefish video in Discovery Channel or National Geographic Channel. Have you seen the movement of the cuttlefish? This is very interesting. This becomes a doctrine of signature. Whenever the sepia, the cuttlefish, starts to move, it will droop the eyelid. The eyelid will droop. This is a doctrine of signature to this case. When I saw the first time for this case, the remedy which flashed into mind is sepia. But I flashed into my mind, oh, she looks like sepia. Then I probed some of the questions to her. After that, I considered the rubric indifferent by seeing this eyes after while talking. So the lids drooping off. You please watch cuttlefish in Discovery Channel or National Geographic Channel. A small clipping will be available. You can see in the YouTube. Whenever the cuttlefish moves, the lids droops. This is the doctrine of signature of sepia. On the basis of that, I used to see a lot of this kind of, especially I used to see cuttlefish, lachesis, rat, vipera. These are in the National Geographic Channel, so that I may get some of the hints in patients as a doctrine of signature. I used to observe their movement. I used to observe their activities in the channels. You please, I'll request you doctors to see these kind of videos. Whenever you are free, a 4 minutes, 5 minutes video in National Geographic Channel or Discovery Channel, so that we can get some hints in some cases, especially in Ophidia, then spider group, something like that in animal kingdom. On the basis of that, I have given her sepia. After that, the patient is completely normal. Actually, I was searching the videos since morning. I'm not getting that video after prescription of sepia. This is the picture of cuttlefish. Sepia 200 single dose I have prescribed. After that, see the lid of a cuttlefish there, eyelid. It is like that. Whenever it moves in the water, the eyelid droops. Just observe. After my session, you can go to YouTube or somewhere else in Discovery National Geographic channels. You can see the movement and characteristic of a cuttlefish. So thank you one and all. I've just shared my clinical experiences today. I think that all the 3 cases were interesting. And yes, let's see the question and answers now.
Really, it was so interesting. We are watching like a movie, what you are going to do, what you are going to select. And after the eye movements, what are the questions you asked her to select the remedy?
Okay.
How you finalized?
After selecting the sepia.
No, after, I mean, you have only observed the drooping of
Yes,
eyes.
yes.
Then after that, you have you ask some questions to.
Yes.
Sure, right?
Yes,
What
definitely. See, I asked about the nature of the patient. Some of the things what the husband said is, on the day of the marriage, patient got fainted in front of people in the Kalyan Mandapam, there itself. I asked why, what was the reason? Don't know. So I thought of she may be hysterical. And what was the thing after that? She was admitted to hospital in the same day, on the wedding day, for 2 hours. Then they came back. Then the Mangala Dharana was happened. That was the situation on the wedding day. Yeah, why she looks like that? And the husband said, "Sir, she is, when compared to others, she is very, very different. She is very, very different in our culture, in our what they say, in their routine activities. The husband is a farmer, basically is a farmer, and she also from a farmer community, and she is very, very indifferent to their social activities. So after listening to that history, I considered it as indifferent. Also, the snapshot prescription was the eyelids drooping. On the basis of that, I have prescribed sepia.
Dr. Manoj. Oh,
I'm not able to hear, sir. So microphone is muted.
okay. Normally.
Thank you, Dr. Ajini. A wonderful presentation. There is no doubt about his potential. We all know that how much he is capable of. I think what was most interesting is the first case where you said about the miasm, the involvement of miasm. How you differentiate between that medicine, lactases, and to that. It's quite interesting. That's a nice presentation, and also the potential, the ability to observe. That's another thing. Then you transform the observed facts into the material rubrics of repertory. That's another important thing. These are the potential problem point to the usual physicians. But anyway, you did manage it and you did succeed. That's the most important thing. Nice presentation. Congratulations, Dr. Gurukiron. You once again proved you are the Guru. Gurukiron, always spreading the rays of wisdom to those who are listening. Thank you.
Thank you, sir. Thank you very much.
Thank you, Dr. Manoj, and other participants, those who want to ask questions, please raise your hands. And
Any questions, not only regarding these 3 cases, any questions regarding my clinical practice, what I have attained a little knowledge, I can spread. I can share it with you.
There's a request in the chat box, Dr. Ajini.
Yes.
Kiran sir, a request, can you give a presentation categorizing mind rubrics under miasm if possible?
Okay, I can take it in some other day, I think. Presentation categorizing mind rubrics under miasms if possible. Definitely I can do it with another session. It will be a nice session also. Thanks for the suggestion, and I'll work for it and I'll get back to you.
There is another question from Dr. Rasa.
There is a case that faints and omits violently.
When she regains consciousness.
When she regains
consciousness.
The case that faints and vomits violently. After vomiting, she faints, or the question is not clear, I think. That faints and vomits violently when she regains consciousness.
If Rasa is here, please raise your hand. You can ask the
Can you please elaborate the question? Is a patient faints before the vomiting, or after vomiting the patient faints?
Please unmute Dr. Rasa. Yeah.
Hello, sir. Thank you. The patient faints, and after he conscious again, he vomit very, very hard. Okay.
Okay. After getting the consciousness. Yeah.
Yes.
Okay.
And I gave him, according to, I gave him a Cortalus horridus, Ipecacuana, nothing happened.
Okay. Think of Veratrum.
I gave him Vatrum album too.
Okay. What was the result?
Result, he fear when he fried from something.
Yeah.
He faint. So I give opium to him, but nothing.
See, basically, I think you have to consider one clear characteristic symptom, which is having the
Yes.
highest mark as an entry point to the case. Then we can convert it into a rubric and we'll get a right remedy. Because there are two things here. Once you said is that he faints after getting consciousness, he faints. After that, he vomits violently. Then also you said, what was the last symptom you said?
He faints because of fright.
Fright, yeah.
Okay, after.
So
Yes.
this is the two different symptoms. If you have to consider fright after vomiting or before vomiting, or the faints, vomiting violently after regaining consciousness. We have to consider which is clear. You have to ask the question and you should be careful enough to observe this condition and we should consider a rubric correctly. Then we can get a right remedy.
Oh yes, you said I must take the vomiting after fright, for example.
Yes, yes. It may be, if that is the reason, if the fright is the cause for this condition, then you should take it as fright before vomiting. Then
Oh, yes.
this rubric
Thank you.
changes. You should
Thank
be
you,
very
sir.
careful. Yeah.
And one more question in the chat. Thank you, M. Rasa. In the first case, there is hyponatremia. Did
Yes.
she receive any sodium chloride IV infusion?
It was given 4 days back in the hospital, but there was no signs of improvement. After giving lacasis, the patient improved very well by the next day. That was the case video before and after, and also the reports before and after. It was fluctuating when they started to give IV sodium chloride.
Well, these are the conditions that the common persons must be aware. The possibilities of homeopathy in treating such cases. If the unfortunate situation happens on 24 hours after the marriage, what will happen? How it should be watched? Definitely, the husband, his mother, his father and mother must go to the police station and court. With some of this dowry problems, maybe they
Yes,
were this. Yes, that is a. It can be explained or it may be watched that way. Definitely, so circumspection, tact, knowledge of human nature, all these things is needed not only for homeopathic physician but also for the common man also. Otherwise, it will be wrongly interpreted, and the unfortunate man has to go to, because it is this non-bailable offense. But Rajini, what is your view on that?
Yes, but everyone is seeing an incident in different aspects. So please kindly take a session. How? What is that? How?
How to convert
Convert.
symptoms to rubrics.
Yeah, that.
Convert, yes, convert symptoms to rubrics.
It's an art. It's an art.
It
It has to come by the practice.
Yes, it has to be practiced. That's the most important thing. I think the Puritan type repertories are very much needed. That is not underutilized, I think. What is your opinion on Gurukiron?
Which one, sir? Which repertory, sir?
The Puritan type, there are two types. If the memory
Yes,
is
sir.
correct, the utilitarian type and the Puritan type. If the Puritan type is not at all properly used. For example, the one is from the concordance repertory, then the sensation acid, then nurse repertory. Well, all these things are not properly utilized. I think Ajini has got some fire on that. Repertory classes, Puritan type, regional repertories, so many types are there.
Actually, I was thinking not even using these things. Puritans.
Now Hariharan sir raised the hand.
Yeah.
Yes. Most happiest person, I think.
Yeah, I have seen.
Hariharan sir, yes. Please unmute, sir.
Okay.
Where is your video?
Okay.
Not seeing you for many days.
Okay. Dr. Gurukiron,
Yes, sir.
very nice to see you.
Thank you, sir.
Okay, Gurukiron, today I have a patient. I will not prescribe the medicine. I will
Okay.
explain that patient's symptoms and what she narrated.
Okay.
See, the patient, for a long time, she is suffering at her husband's house for the last about 8 years, suffering from her mother-in-law, her husband, her father-in-law,
Okay.
her sister-in-law, suffering
Okay.
for 8 years.
Okay.
Now she came to me for consultation that she is having some dyspnea while talking, and I observed that the thyroid, at the place of the thyroid, there is an that is enlarged. She is having some cough also. See, that is the first symptom. Second is that she is having fibroid at her uterus.
Okay.
Along with fibroid, she is having menorrhagia.
Okay.
Fibroid also. Then my doubt is that, not my doubt, that I took the case and kept it in my dispensary, and a lot of other symptoms I gathered from her. But my doubt is that if I am prescribing only with that mind, is all other symptoms, that is thyroid, as well as
Fibroid.
as well as menorrhagia,
Okay.
will be cured or not?
Yes, sir. Definitely, sir. Sir, we have to look into case in a mathematic way. This fibroid is highly psychotic. So, according to the theory, according to Dr. Praful Vijayakar says, if there is any syphilitic rubric, any syphilitic symptom in the case, please take it as an entry point in the case. We have to hunt for an PQRS, or the peculiar, uncommon, or syphilitic symptom in a case. It may be mild, it may be in physical generals, or it may be in particulars. If we enter a case through this, then it has got the highest mark. Then after that, we have to retrospectively see the totality, including this fibroid and the menorrhagia. If it is treated well, definitely all these problems will definitely go, according to me.
Is the mind symptom?
Not only, sir, that's what I'm telling. It has to have the highest mark with syphilitic entry point. Not only that, retrospectively, we have to look for the fibroid and the menorrhagia symptoms in that particular remedy.
Okay, I will try.
Only that we can consider a remedy, and we can prescribe. On the basis of that, the patient has to do well after prescription. If that is not the case, if there is no highest syphilitic symptom, if there is no entry point to the case, then we have to consider the totality of the case. Or otherwise, we can go for a constitutional approach.
Sir, I think due to the continued grief of that lady,
Okay.
caused all these symptoms.
Definitely, sir. Then we have to look for an ailment.
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 That-
Ailment from what was the single point? What is she having? That will be the highest marks.
Highest
we can
mark.
enter a case.
Okay. If I am prescribed such a way, naturally all other symptoms will be disappeared.
Definitely.
Disappear. I think so.
Definitely, sir. Because that is the entry point. The causation is there. The result of the disease is what you are saying is the fibroid and menorrhagia and all. That will be the result of the disease.
Correct.
If we get the right ailment, if we get the right cause to the prescription, we can enter a case through that.
Good.
Thank you, sir.
Okay. I want to know your opinion, and tomorrow I will advertise it and give the medicine.
Okay, sir. Thank you.
Thank you, Dr. Hariharan, and no one else has raised.
Dr. Reza is again raising the hand.
Again, I think it was
Previous one.
No.
again. Is not unmuting.
It's always better to lower the hand after the question is being answered. Always, otherwise we cannot identify who answered or who is expecting. Yes. So just do it.
Any questions?
Sir, excuse me.
Yes.
Yes, you work according to late Vijayakar method and the miasm of the Dr. Praful Vijayakar.
Yeah.
Okay. But it's not the Hanumanian miasm. Yes,
Which one, sir?
it's
Which
different
miasm?
from Hanuman.
Yeah, it's
The Vijayakar view of miasm is different with the Hanuman view of miasm, I think.
not so different actually. What they have, what the Vijayakar sir has done is, he has applied some pathological aspects to it with allied sciences, and he had given us some knowledge according to that. There it is different, that's all. But the basic theory of miasms, what is there according to Hahnemann, what it is the same. There is no different in that. He has regulated all those things in applying allied sciences, also pathology to it, and he has given some set of symptoms, and he has differentiated symptoms, which is syphilitic, which is psychotic, which is soric.
Doctor, can I
Thank you, sir.
speak, Dr. Manoj?
Yes, sir.
Dr. Gurukiron, now we
Sir.
are seeing a lot of ladies have these menstrual problems, fibroid and PCOD
Yes.
and infertility.
Yes.
What will be the miasmatic cause?
Definitely, sir. These are all psychosyphilitic nowadays. Not only we don't get any pure single miasmatic cases in our clinics. All will be sorosyphilitic, psychosyphilitic, or we may get frank syphilis cases. Frank syphilis. If that is the case, the prescription will be very easier to a homeopath when we look for a frank syphilis. Otherwise, all the cases what we get in our clinics are psychosyphilitic, having the tubercular diathesis, or the sorosyphilitic cases. In those cases, on the basis of, if we start to treat, if we start a treatment of a basis of only psychotic symptoms, the result will be zero.
Okay, very good.
We have to hunt for an PQRS, uncommon, peculiar, or a syphilitic entry point to the case. Till that, we have to hunt a rubric in a case. When we get these kind of symptoms in a case, definitely that will be an entry point. We can enter a case through that, considering all other totality of the symptoms.
Thank you.
See, which author described it detailing? Is it Praful Vijayakar?
Yes, sir. If you can see in the works of Dr. Praful Vijayakar's sir books, it is there in my assumption based on miasms, one thing, and verbatim his book, and also one more thing, the rubric based book. There is one more, I forgot the title. Rubric based book is there. On all those things, he has given clearly the picture of what are the syphilitic rubrics, what are the psychotic rubrics, what are the soric rubrics, on what can we see in a case.
Okay, I have all these books with me, so I will, I will try to read it.
Yes, sir, definitely,
Okay,
sir, definitely.
okay. Thank you, thank you.
Thank you, Dr. Harikaran.
And basic thing is what Hahnemann has said is being unprejudiced observer. We should be unprejudiced, each and every case. Recently, today morning, one case, PCOS case got cleared from arsenicum album. This was the first case I have prescribed arsenicum album to this case. I haven't prescribed any other case of PCOS arsenicum. This is the first case of arsenicum album. PCOS has been cleared on the basis of the symptom.
Can you, are you remembering that symptoms?
Definitely, sir.
Okay,
The
tell me.
patient is highly restless. The patient
Okay.
is mentally highly restless. The
Okay,
patient is having anticipatory anxiety, 3 marks.
anticipatory anxiety.
Yes,
That is
he was
urgent
having
night.
very much anticipatory anxiety. He was fastidious, very much fastidious. She was irritative. And she was very impetuous. I would like to say rubric impetuous.
Infectious.
Yes, these are all the things I have considered in the case. On the basis of that, I have prescribed arsenicum.
Her
This
thermal,
one is got cleared.
her thermal.
Chilly.
What about her thermal?
Chilly. The patient is chilly.
Okay. Anticipatory anxiety. Why you selected the arsenicum? Is it the argent and nitricum? Why you not selected?
Because all those things, argent and nitricum is a hot remedy thermally.
Okay.
First thing.
Thank you. Very
And
correct. I am expecting from you that.
in arsenicum, also along with anticipatory anxiety, the patient is fastidious.
Fastidious.
And the mind is very restless. Very, very restless. What I have experienced is when she come to my clinic, to my chamber, especially when she sit in front of me, she asks one question. Within a second, she jumps to another question, another question, another question.
Okay.
Within no time, she may be asked 4 to 5 questions. So
Okay.
much mental restlessness.
Okay.
On the basis of all those things, I have prescribed arsenicum. The PCOS got cleared. Today morning, I got a report.
Very easy prescription.
Yes.
If you know the constitutional symptoms, very, very easy prescription. Homeopathic prescription is very easy when you know the materia medica and the constitutional symptoms. See, very, very easy to prescribe and you will get the result. That is 100%. No doubt in that.
Yes.
Very,
The
very
patient
good.
was suffering from PCOS since 2019. She has
Okay.
gone to a number of gynecologists all over their city, but without any improvement, without any result. She came to me 4 months back, I think, 4 to 5 months back. She got clear.
What is her age? Age
26.
26.
And
Very
the
good.
problem
Very
is
good.
she is
And
after getting
the
married
chat box,
3 years back, she is
answer
not yet
what
conceived. Yeah.
Asking about the potency, doctor.
200.
Here another one, a male child, 6 years, allergic bronchitis every month with a fever and vitamin D deficiency. What would you suggest in cases severe leg pains, night every day, and bronchitis periodicity is very much marked?
Yes. First thing in this case, we have to make a totality of the symptoms. Then for this every month recurrency, to stop this every month recurrency, please prescribe tuberculinum bovinum 1 m. Tuberculinum bovinum 1 m single dose. You can prescribe to stop the recurrency every month. Then please make it a totality and you can prescribe.
For the personality disorders and all, for that also you are selecting, giving the constitutional remedy. I mean,
Yes, definitely. Yes. See, when I would like to prescribe higher potencies in these kind of cases where the PQRS symptom, peculiar uncommon symptom, is very, very characteristic, which is having the highest marks. If it confirms the remedy, this is the only remedy. If I get the confirmation, definitely I would go to prescribe higher dose, 1 m, 10 m, 50 m maybe, depends on the susceptibility of the patient. Tuberculinum every month for how long? No, tuberculinum 1 m, 15 days once. You give 2 doses in a month, then you will see the result. Then you can continue with the totality, making a totality and followed by constitution.
thank you, Dr. Gurukiran. And someone, Dr. Roshna is asking your number. Please text your number in the chat box. And thank you for joining with us. It was a wonderful session. There is no doubt about that. Thank you so much and see you again. And now it is the time for our Malayalam session.
Okay.
And thank you all the participants for joining with us. And thank you, Dr. Gurukiran, once again.
Thank
And
you.
we are eagerly waiting for your next session. Thank you. Thank you so much.
Definitely. Thank you. Thank you very much. Thank you, one of them.
And now it is a time for Malayalam session. I don't know, Dr. Manoj or Dr. Danesh. I'm welcoming Dr. Danesh for conducting Malayalam session. Before that, someone is asking, I don't know the name. I have seen in the chat box, someone is asking the recording of this session. I already mentioned you while I'm hosting. Please go through our YouTube channel. We have IFPH have YouTube channel. So please watch the missed session in our YouTube channel. You can see all the videos in our YouTube channel. You can subscribe our channel and you can watch whenever you want. If you want to repeat the session, means you can repeatedly see in our YouTube channel. Thank you so much. And once again, I'm telling, please mention your name and photo in the while joining in the Zoom session. That will be easy for us to identify you people. Thank you so much. And Dr. Danesh, please welcome to conduct Malayalam session. Moderate. Ayo, it's Doctor.
Yeah.
Yes. Thank you, Dr. Rajini and Dr. Gurukiron for a wonderful session here. Namaskaram.